Hello everyone, my name is Pete Aguirre and I'm the Director of Quality at Valley Regional Medical Center. Today I will speak to you about what is stroke. 2,400 years ago, the father of Western medicine, Hippocrates, defined stroke as apoplexy, which means to be struck down with violence. There was no explanation as to what this horrible disease was. Suddenly the patient could not move, could not speak, and had a drooling face. The only explanation he had was that the god struck you down with violence. Today, stroke is the fifth leading cause of death in the United States. It kills about 140,000 Americans each year. And on average, every 40 seconds, someone has a stroke in the United States. Every year, about 795,000 people have a stroke. 610,000 are new strokes, and 185,000 are recurring strokes. Strokes cost the nation $34 billion a year, which includes the cost of healthcare services, medications, and lost productivity. The good news is that 80% of all strokes can be prevented. Today, we define stroke as a sudden interruption of blood flow to the brain. There are two types of stroke, ischemic and hemorrhagic. Ischemic strokes happen about 85% of the time, and hemorrhagic strokes 15% of the time. An ischemic stroke occurs when a blood clot stops the blood flow from an area of the brain. A hemorrhagic stroke happens when a weakened or a diseased blood vessel ruptures. We divide the risk factors in two sections, the non-modifiable risk factors and the modifiable risk factors. The non-modifiable risk factors include age, heredity, race, sex or gender, previous stroke, heart attack, or TIA, which means a transient ischemic attack. The modifiable risk factors include high blood pressure, cigarette smoking, diabetes, atrial fibrillation, high cholesterol, poor diet, physical inactivity and obesity, or other problems with your blood vessels. There's a simple test you can do. It is called the B-FAST test. B stands for balance. Does the person have a sudden loss of balance? E stands for eyes. Has the person lost vision in one or both eyes? F stands for face. Can a person smile without one side of the face drooping? A stands for arms. Can a person raise both arms without one arm drifting down? S stands for speech. Can a simple sentence be repeated without slurred speech? And T stands for time. If you notice any one of these symptoms, it is time to call 911 immediately. By knowing the risk factors and how to identify stroke, you can save a life. Remember, when it comes to stroke, time is brain, so be fast. Thank you.